Hi guys, it's Colleen for 3 Fun Facts today. So today I'm with Dr. Paul, and Dr. Paul is going to talk about, he's from Sleep Better, Kansas, and we're going to be talking about that and what that is. But first we want to know 3 fun facts about you. So tell us your first fun fact.
Yeah, thanks for having me on this call.
Sure,
I
I'm so
appreciate
excited.
it.
I'm so excited.
Sure, yeah, my first fun fact is I grew up in Pratt, Kansas, South Central Kansas. My dad is a farmer down there, mainly dryland crops.
Okay.
And so I grew up working the ground, doing mainly wheat farming and milo, things like that.
Okay.
And I loved it, but that's the one thing I found I'm allergic to in the world. It gives me asthma, is the wheat dust.
Oh no, that's awful.
So it got me out of a lot of the worst jobs.
Yes.
And I knew I had to find something else to do with my life.
Sure.
So that
That's awful.
helped me push this direction,
There
but
you go.
I did enjoy what I could do.
Good. Cool.
Yeah.
Okay, so tell us your second fun fact.
Sure. Something I enjoy doing outside the office is ultra distance biking and running. I've ran across the Grand Canyon. I've run in the mountains of Colorado. I've done an Ironman triathlon.
Wow.
So all sorts of different kind of things like that where you push yourself, but it's just something that I enjoy doing.
That's amazing. That's awesome. Yay, good for you. So tell us your third fun fact.
Yeah, so like you said, I own Sleep Better Kansas, and we'll be mainly talking about that today.
Okay.
But I'm also, like you said, a dentist here in Wamego. I own Wamego Dental Center with my wife here.
And he's a good dentist. He's my dentist.
Thanks. So this is kind of more a side business, I suppose. Just some other way that I can use my dentistry to help people. And to do that, I had to form this extra business, and it kind of helps people recognize it as something separate.
Okay.
But yeah, so I'm a dentist as well as doing the sleep business.
Okay, cool. So now we're going to talk about what does Sleep Better Kansas actually do.
Yeah, so like the name says, we want to help people sleep better. What we want to do is help people with their screening, diagnosis, and effective treatment of sleep apnea. Is what we're helping people with. So first of all, what is sleep apnea, right?
Right.
And so, a lot of people have heard about that maybe, and wearing CPAPs is kind of the common thing that people have heard about with it.
Sure.
But sleep apnea is mainly when you're falling asleep or when you're asleep, the muscles in your throat and neck relax, and so they collapse, and so they block off the airway. And so you're not getting air while you're sleeping, and that is called an apnea. And so too many of those can compromise the blood flow, oxygen going to your body, and cause lots of health consequences.
Oh my goodness, that sounds horrible.
And so helping people be aware of that, finding out who has it, that's mainly what this business is for. So starting with the screening for people. We screen every patient that comes through our office for it. And people might wonder, well, why are you doing that at a dental office?
Sure.
Right. Sure. But being a dentist, we're in a unique spot to be able to help with this, along with medical doctors, because we look in the mouth and the head and neck area. And that's where a lot of these problems are. And so we're looking at the tissue in the throat, at the dentist exam, we look back there for cancer, but we also can look for this as well. There's also dental signs, wear on the teeth, things like that can actually have a root cause in while they're asleep. They're not getting the air they need, and so they're subliminally pushing their jaw forward, trying to get that airway open, and that results in grinding of their teeth. So there's other things that we can see dentally that can be signs, little clues that maybe something's going on with an airway. With kids, it can be like tonsils, adenoids, things like that. So, we're looking for all ages for those that need to be screened further.
Wow.
Once we've identified a patient as someone that needs further screening, the next step is that sleep test. Okay. And that's something that, people have probably heard about. I have to go into the lab and sleep somewhere. So we try to make that as easy as it can be for people. We use a service that actually mails a device to their house.
Oh, wow.
And so they get to do it in the comfort of their own home.
In their own bed.
In their own bed.
How cool is that?
So you just hook up a few pieces to your finger and around your chest and go to sleep with it. and just a lot easier than
Oh, yes.
in a
Way less
lab.
intimidating.
And
Yes,
yeah, right,
yes.
less intimidating. So you get the results from that. You get to actually also talk with a sleep physician through that service as well. So we're integrating that medical component in there.
Oh, good.
And then we get the results back and we talk with people about it.
Wow.
So at that point we know, is there a problem?
Okay.
Right?
Okay.
And how bad is that problem? So depending on those things, we find out what options are available for them.
Okay.
Generally there's 3 options. There's a CPAP, like
Okay.
people know about, the
Okay.
face mask that
Okay.
blows air down your throat to help keep it open so you're not choking while you're sleeping.
Okay.
Surgery, try to surgically open up that airway.
Okay. I didn't realize there was surgery that you could do. Okay.
Yes.
Okay.
Generally they are kind of the last resort because that tissue a lot of times can come back.
Okay.
But for some people that's what's needed.
Sure.
And then a third way, which is kind of maybe not to say the main reason why we got into this realm, because screening is something that we'd want to do regardless, but it's the thing that only dentists can help with, which is oral appliances.
Okay.
So a CPAP works by blowing the air down your throat, like I said. An oral appliance works instead of pushing air down your throat, we are posturing your lower jaw slightly forward. So by posturing that jaw forward, it's going to pull that tissue at the back of your throat tighter, and it's going to keep that from collapsing.
Oh, for heaven's sakes.
Okay, so this is an example of prosthesis that we do, and it's kind of like you think of like those Invisalign trays, kind of like those neck guards.
Mm-hmm.
So think of like a heavy duty version of that on both the top and the bottom, and then there are these little pegs on the side. And so like you can't open all this way, right? You can only open this far.
Okay.
And so it doesn't let your lower jaw drop backwards
Sure.
while you're sleeping.
Sure.
And so it keeps that forward just enough, and we can adjust how far forward we go. And that will get us the advancement we need to keep your throat open.
So this would be in place of the sleep apnea
Yes.
machine?
Yes,
Okay.
yes. For most people, we'd be able to do that in place if it's something that we deem that they're a good candidate for this.
Okay.
They could use this in place of
In
their
place of
CPAP,
that.
which is good for a lot of people because less than half the people that start with a CPAP, you follow up with them after a year, sitting in the closet.
Yes, I've
right?
heard of a lot of people that way, and it's like if you're not breathing or if you're not getting good air anyway.
Yeah,
Wow.
it doesn't do any good sitting on the nightstand.
That's right.
For people that use it and it works well for them, power to you, and
Sure.
we're happy for that.
Yes.
We want to help people sleep better no matter which direction we push them.
Sure.
But for some people that can't tolerate it, or it's just they don't have to do it,
Sure.
this can be a really, really good option for
Oh my
them.
goodness,
So,
how neat is this?
and that's something that only dentists can make. So that's
Sure.
part of why it hasn't really gotten much traction, because that connection between the medical side of the world and the dental side of the world just doesn't happen very well.
Okay, sure.
Sure.
So what's the best way for people to get hold of you to find out more information or to schedule?
Yeah. So first of all, with that, you don't have to be a patient at my dental office to get involved with this. We get people referred from doctors' offices all the time, or people that just find us and say, hey, I want to look at this as an option. Because we can pick up at any point in that process. If someone's already had a sleep test, come on in. If someone has been on a CPAP for years and hasn't really used it, or they hate it, come on in. We deal with medical insurance. People that have Medicare, this is a covered benefit of Medicare, and we work with that.
That's amazing.
So
that's incredible.
We really try to get out of kind of just the dental side of things with dental insurance. But to answer your question, our phone number is 785-456-8527.
Okay.
And that's a good way to start reaching us.
Okay. Well, thank you so much for letting us know about this, and yeah.
So, thanks again for having me.
All right. Well, we'll see you guys next time on 3 Fun Facts by Colleen. Take care. Bye.